Okay, so good evening, everyone. I'm Sonia Joseph, Treasurer of Community Nutrition Forum. So, as everyone know, Community Nutrition Forum is an initiative aimed at promoting health and well-being through nutrition education and lifestyle awareness at the community level. So, as you all know, this is a platform where healthcare professionals, nutrition experts, and community members come together to discuss common health concerns. So we also share the evidence-based knowledge and encourage preventive health practices. So it gives me a great pleasure to welcome all the trustees, office bearers, as well as the executive members and all the participants for today's Dietopedia session. So today we'll be focusing on nutrition aspects of polycystic ovarian syndrome by Dr. Jyothi Krishnan, and she is the chief clinical dietitian at Believers Church Medical College Hospital, faculty of Believers Academy of Allied Health Sciences and College of Nursing, and she has 20 years of experience in the field of clinical nutrition and dietetics, and she is being awarded the grant from Harvard University USA for the project for early detection of albuminuria to mitigate renal and cardiovascular risk in diabetic patients. She has also received Sadhana Award in 2026 on the occasion of Dietetics Day at NIN. And she has also received Ayyappan Quality Award in 2024 as well as Extra Mile Award in 2021. And she's also the registered dietitian and life member of various organizations like IDA, NSI, HSI, ISPAN, CNF, and Ayyappan. And she has also delivered oral and postal presentation in various international scientific forums, including PENSA and ISPAN. And she has also published several research papers and also co-authored an ICMR funded book titled Diabetic Delights for Diabetic Patients. So we are really honored to have you, Jyothi, as our speaker for the day. And once again, I'm welcoming you to the session. So thank you. And over to you, Jyothi.
Thank you, Sonia, for the kind introduction. At this outset, I thank the Community Nutrition Forum, all the office bearers for inviting me for this session. Today, I will be talking on the topic nutritional strategies to modulate hormonal imbalances in PCOS. That is my PhD topic also. So it is. I'm not think. I think I can share that slides right now.
Yes, please.
Yeah. Is it visible to everyone?
Yeah, you can make it full screen also, Jyothi.
I think it is visible.
Yes.
Okay, so as I mentioned, the topic for today's presentation is on nutritional strategies in PCOS. Everyone is aware of what PCOS is. It is a hormonal disorder, especially an endocrine disorder which affecting the women of reproductive age. And the diagnosis of the polycystic ovarian syndrome can be done using the Rotterdam criteria, where at least 2 out of the 3 of the symptoms like irregular or absent menstrual cycles, hyperandrogenism, both the clinical and excess both the clinical and the biochemical values which is present in the patient, and also with the polycystic ovaries which is present in the ultrasound. If any of the 2 is present in one person, then they are considered as having polycystic ovarian syndrome. So understanding the PCOS phenotypes, there are 4 phenotypes. Phenotype A is having ovarian dysfunction, hyperandrogenism, and polycystic ovarian morphology, whereas phenotype B has ovarian dysfunction, hyperandrogenism. There will not be any polycystic ovarian morphology in this case. And phenotype C has hyperandrogenism and polycystic ovarian morphology, where the patient will not be having ovarian dysfunction. And phenotype D is having ovarian dysfunction with polycystic ovarian morphology, and where the patient may not be having hyperandrogenism. So among these all types, we mostly see in the phenotype A and phenotype D. So the pathophysiology, it is a complex pathophysiology, and mostly in polycystic ovarian syndrome, the patient may have the pituitary hypothalamus will produce gonadotropic releasing hormone, and where it is actually stimulating the LH in the ovarian theca cells. So in the ovarian theca cells will produce more luteinizing hormone, that is LH, and further it will cause more production of androgens. Androgens are male hormones. And at the same time, there will be a decreased FSH or follicular stimulating hormone production in the ovarian granulosa cells. And this FSH is actually converting the androgens into the estrogens. So that process will not be happening, or it will be reduced in the PCOS patient. And all these results in hyperandrogens. There will be more androgens, or the male sex hormones will be produced more, and that will be present. It will be causing insulin resistance in the patient, and insulin resistance further causes hyperinsulinemia, that is high levels of insulin in the blood, and that can further lead to low levels of steroid binding globulin in the liver, and further it can cause more androgen production in the ovarian theca cells. So actually what happens in this pathophysiology is the HPO axis, that is the hypothalamus ovarian axis, where there is more androgens will be produced, further causing increased insulin or hyperinsulinemia, and which again is causing more androgen production in the ovarian cells. So there will be overall there will be more androgen and hyperinsulinemia. And the second hand of it is the HPO. Other than HPO axis, there is another axis called the HPA axis, where is the hypothalamus and android adrenal axis is happening, in which the brain or the hypothalamus will be producing the more CRH hormone. CRH hormone will be activating the pituitary gland to produce ACTH. All of you aware about ACTH. ACTH further increasing the production of more cortisols and androgen in the adrenal cortex. So it is an axis called HPA axis, where there is more production of cortisol and androgen is happening through the adrenal cortex. So in both the pathophysiology, there will be more androgens in the blood, and thereby which this androgen itself is increasing the insulin resistance and hyperinsulinemia, and thereby, and the other point which I would like to say is, like, most of the person, maybe not only the PCOS patient or some other girls which are obese, also having high amount of adipose tissues in the body, and this adipose tissue is actually causing decreasing the uptake of insulin and increasing the lipid accumulation in the body, and all these will further increasing the androgen levels in the body. So what exactly causing the pathophysiology is the hyperandrogenemia along with the hyperinsulinemia. All these together decreases the glucose uptake, increases the lipid accumulation, decreasing the SHBG. SHBG is the serum liver levels of serum SHBG levels will be low, and thereby decreasing the levels of insulin like growth factor, thereby affecting the glucose metabolism. And the ultimate result is disrupting the luteinizing hormone and FSH balance, thereby irregular ovulation will be happening, and thereby promoting the estrogen dominance. Most of the time there will be more estrogen in their body, that causes weight gain along with PMS symptoms. And always the person may have increased androgen levels, especially testosterone. So what is happening when you compare the regular cycle with the PCOS cycle? The first left-hand side of it is the regular menstrual cycle, where there is a normal production of FSH and LH. It is almost equally produced in the body, and at the mid of the menstrual cycle, the LH surge will be happening. There will be more LH production in the mid of the menstrual cycle. That is happening in a normal cycle, whereas in PCOS, what is happening is the LH normally is quite high compared to the FSH levels. So the levels of LH are so higher than the FSH, and because of this high LH level, there will not be any LS surge is happening. So without the LH surge, the ovulation does not occur, and the person may suffer from irregular menstrual cycle. So when you compare the risk factors and symptoms, there are different risk factors for PCOS: genetics, epigenetics, unhealthy diet, environmental toxins and pollutants, obesity, sedentary lifestyle, and lack of physical activity. All these can contribute to PCOS, and the symptoms that you may experience is the acne, hirsutism, that is the excessive facial and body hair; alopecia, that is the hair loss, that is male like balding; and the irregular or missed periods, insulin resistance, difficulty to conceive, sleep apnea, stress, and depression. These are the most common comorbidities associated with PCOS. Then, when you check the blood parameters, all of us may be knowing, like we may be checking the fasting insulin or the glucose levels, fasting glucose, lipid levels, everything. We know that because the metabolic dysregulation is there, definitely there in PCOS. But what are the hormones that you want to check in PCOS? The first one is the testosterone. Normally, in PCOS, the levels will be more than 50 nanograms per dl, and I already mentioned that the LH to FSH ratio is normally it should be 1:1. In case of PCOS, it is normally 2:1, or sometimes it may be 3:1 or 4:1. Fasting insulin is always greater than 10 mmols per ml, and fasting glucose can be more than 100 milligram per dl. Then the ovarian androgen, that is the androstenedione, that is more than 200 nanograms per dl. These are the typical blood parameters which we can observe in the PCOS patients. And we actually, there are two axes involved, the HPO axis and the HPA axis. So the doctor has to actually, there may be a chance of misdiagnosis also. So what are the different parameters that need to be diagnosed to identify that it is related to PCOS is that hypothyroidism, hyperprolactinemia, or some tumors or some adrenal or hypothalamic involving tumors may be one of the reason. Then the Cushing syndrome may be another reason. So all these has to be found out before diagnosing PCOS. So in order to diagnose this, usually in the hospital setting, what are the investigations that we do are the thyroid function test and prolactin levels, because the hyperprolactinemia can again be another area where there will be a lot of misunderstanding related to it may be affecting the fertility problems also. Then free testosterone levels, that is it is otherwise known as the free androgen index. It is best marker for ovarian androgen production. Then DHEAS, that DHEAS is the androgen which is produced by the adrenal axis, because of the adrenal tumor there may be high levels of DHEAS that can be misinterpreted as related to PCOS. So anti-Mullerian hormone is another one, and it is usually tested in context of infertility. Then fasting glucose using OGTT and lipid profile. These are the common investigations. Then clinical symptoms include acne, the hirsutism, alopecia, and the alopecia is of two types we can see, and the acanthosis nigricans also. Ultrasound, if we check the polycystic ovary may be having a 12 or more follicles measuring 2 to 9 millimeters, and there will be increased ovarian volume of greater than 10 cu per mm. So the pharmacological treatment, the common medications in case the patient is obese or having some impaired glucose tolerance, definitely metformin will work, and which will lower the circulating insulin. Hepatic glucose production will be low. Then it also lowers the androgen levels and promote ovulation, and it is reducing the risk of miscarriage too. Then clomiphene citrate is a first-line drug for ovulation induction, where estrogen receptor modulators, these are modulators, which can increase the FSH and LH release, and which can always stimulate the dominant follicle, thereby promoting ovulation. Then spironolactone is a diuretic where it is used as an anti-androgen, which is used to treat hirsutism, and it reduces the testosterone levels and slows the hair growth. The other one is inositol, that is the myoinositol and the decheiroinositol, in which myoinositol support the FSH signaling and ovarian function. And in PCOS, there will be hyperinsulinemia, which will disrupt the FSH-LH balance and follicle development. So both MI and DCI can improve the insulin sensitivity, restore ovulation, improve oocyte quality, and reduce the androgen levels. Then another drug is a letrozole, where it can be used as an OCP, oral contraceptive pill, where it will cause that it is a major ingredient which contains progestin, which causes a thinning of the endometrium and which prevents the implantation of the fertilized egg, thereby preventing the sperm from reaching the eggs and thereby preventing the pregnancy. So how these OC pills is working is by this phenomena. And what are the treatment options in this PCOS patients? First one is a lifestyle modification, where we always aim on weight loss, and we always tell the patient to decrease the abdominal fat, and there may be some hyperandrogenism or insulin resistance. All the weight reduction will help in reducing insulin resistance and hyperandrogenism. And the measures to modulate the menstrual cyclicity and improving the fertility are another concern where we do when we do the lifestyle modification. And what are the dietary strategies? The main dietary strategy is the low fat, low calorie diet, and replacing the proteins with carbohydrates and use of a very low carbohydrate diet. So what are the main goals of this lifestyle intervention is to improve insulin sensitivity, maintain healthy weight, regulate hormones, reduce inflammation. So how we can reduce inflammation is by it will disrupt the endocrine signaling pathway and hormone receptor sensitivity throughout the body, and persistent inflammation usually elevates the stress hormones, which creating the hormonal imbalances. Insulin resistance, normally the inflammatory cytokines impair the insulin function, affecting the reproductive hormones and metabolic balance. So all these four aspects we need to consider while we do the lifestyle intervention. So the main diet is an anti-inflammatory diet. We have heard about this for long time, but what this anti-inflammatory diet is doing with the PCOS is by increasing the reducing the oxidative stress and decreasing the peroxidases in the body. And we know that most of the plant-based foods are anti-inflammatory, especially beans, soya bean, tofu, fruits like berries, citrus fruits, melons, avocado, etc. And along with that, omega-3 rich fishes like sardine, salmon, etc., along with whole grains, bran cereals, millets, oats, and some vegetables such as sweet potatoes, which are having vitamin A, are all considered as anti-inflammatory, and along with PUFA and MUFA and probiotics and antioxidants, which are actually helping for overall health promotion, metabolic wellness, cognitive health enhancement, and prevention of chronic diseases. So these are some examples of anti-inflammatory diet for PCOS, and the curcumin, ginger, berries, the cinnamon, leafy vegetables, and mixed all vegetables, including the colored vegetables. So glycemic index also plays an important role, where we have to give a low glycemic index food, where low glycemic index food of less than 55, and focus on more vegetables, especially those with a low carbohydrate content, spinach, tomato, and lettuce, cucumber, celery, etc. are some of examples. And among the fruits also, the low glycemic index fruits like apple, orange, papaya, etc. has to be considered. And the dairy products, like always focus on low fat yogurt and skim milk and low fat food items. And proteins are very essential because proteins are helping proteins, especially those with whey proteins and other proteins which containing all the essential amino acids, will help to improve the insulin resistance and also help to improve the gut microbiota, thereby reducing the insulin resistance and inflammation. So why protein is essential? Because that it helps in support the hormone synthesis, and it maintains a lean muscle mass, balances the insulin levels, support fertility and ovulation, reduces inflammation, improves satiety and weight control. So other than this, it also increases the production of incretin hormones, GLP and GIP, and thereby reducing the glycemic hyperglycemia in these patients. So how the protein should be supplemented is by, this is a chart which contains 10 grams of protein per each food item, where I have included all the vegetarian and non-vegetarian food items. So as to make it easy, this table will help you to identify the protein exchange of each food item, and it is better to select those food items which are having more proteins and fiber in the diet. So in each meal, when you distribute the meal, it should be better to supplement at least 15 to 20 gram per meal, so as to get a high protein diet. So what is the role of vitamins and minerals in PCOS? We know that most of the vitamins and minerals are which, especially the B complex vitamins, will regulate the homocysteine levels, and which helps to mitigate the inflammation and oxidative stress associated with PCOS. And other than that, the vitamins like B1 and B12 are essential for improving the fertility and also reducing the common symptoms of, especially B6 is helpful in reducing the common symptoms of PCOS such as acne, mood swings and fatigue. And the major minerals which is contributing are zinc, which is actually essential for the reproductive health and which will help to lower the testosterone levels. Magnesium is help to improve the insulin sensitivity. Iodine helps to improve the estrogen breakdown and support the thyroid gland. And selenium is always an antioxidant and it supports the thyroid and insulin function. And vitamin C supports in progesterone levels, and vitamin D support the insulin function and helping to reduce the inflammation. And chromium is always involved in the glucose metabolism, which support the insulin function and lowers the free testosterone levels. And myoinositol is always helpful in better insulin function. So what are the different roles of other vitamins, especially vitamin A, vitamin C? I already mentioned that vitamin C is always helping to improve the ovulation and fertility, whereby lowering the androgen levels. Vitamin E is also helpful in regulating the menstrual cycles. Magnesium is always alleviating the symptoms like fatigue, irritability, sleep disturbances, etc. Zinc is essential for immunity, skin health, and fertility. Iodine and selenium is always helping for thyroid function. Chromium helping insulin sensitivity, and which helps to reduce the craving for the sweets. So in detail, how vitamin D is helping to reduce the symptoms of PCOS is, normally vitamin D deficiency is linked to irregular periods. So when a person is coming with PCOS, we should check the vitamin D status of the patient, because it can cause irregular periods, hormonal imbalance, and thereby leading to infertility. So we know that always low levels of vitamin D disrupt the calcium balance and thereby affecting the ovulation. And when we give vitamin D, it can help to improve the insulin sensitivity and enhance the egg development. And the major support, actually, the vitamin D is a major support for both metabolic and reproductive health in PCOS. So these are some of the foods which are rich in vitamin D. When we talk about vitamin D levels required for a normal adult is 600 international unit, and we know that most of the food sources are very low in vitamin D, but in order to maintain the or replenish the vitamin D status, we have to definitely focus on vitamin D rich foods along with sunlight exposure, which will promote the synthesis of vitamin D under the skin. And other than that, if the vitamin D deficiency is more, if it is less than 15 nanograms or so, we have to supplement vitamin D as per the physician's advice. Then what is the major role of omega-3 fatty acid in PCOS? Omega-3, we know that omega-3 fatty acid reduces the inflammation in PCOS, but which kind of omega-3 fatty acid we should give in this patient? We know that flaxseed, routinely we have heard about the seed cycling in PCOS. So what do these flax seeds do with the PCOS? Because it contains alpha linolenic acid, and we know that the conversion of which is very small in happening in the body. So the exact content which is present in flaxseed is the lignan, which is actually, it is not the omega-3 fat, it is the lignan which is supporting the estrogen balance in the PCOS patients, thereby supporting the ovulation and so on. But when we supplement the omega-3 fatty acid, we should focus more on the marine sources, especially salmon. Of even 100 gram of salmon, we can't take salmon in India. It is less available here, but even 100 gram of salmon can give you 3 grams of omega-3 fatty acid. Even sardine is having comparatively higher amount of omega-3 fatty acid. But in order to make the proper ovulation, we have to provide at least 1 to 4 grams of omega-3 fatty acids daily. And the rich other sources of omega-3 fatty acids include walnut, mustard seeds, garden cress seeds, soya, fenugreek, and drumstick leaves are some very small amounts are present in these food items. So next is about seed cycling. Maybe everybody is aware of seed cycling, and how we should give seed cycling is by the first day of menstrual cycle to the 14th day, we have to give 1 tablespoon of flax seeds and 1 tablespoon of pumpkin seeds. And the theory is that it supports the estrogen balance through the lignans and the zinc content in it. The second part is the 15th day to 28th day is the sesame seeds and sunflower seeds, each of which is 1 tablespoon per day, and which will support the progesterone balance through vitamin E and selenium content. So these are some studies which have shown the results in some patients, but I don't think these are the studies which are actually deeply involved in molecular mechanisms of this seed cycling, but they have shown some positive impact on patients. And in first study is 30 gram of flaxseed powder was given to the patient for 6 weeks, and there was a reduction in the abdominal fat, testosterone levels, and inflammatory markers. And second study done by Irfan et al. Is the first phase. Exactly the seed cycling was done. The first 2 weeks with the flaxseed and pumpkin seeds, and the second phase of it is with the sesame seeds and the sunflower seeds. And the omega-3 suggested in the treatment of PCOS improve the insulin resistance, decrease the triglyceride levels and LDL levels, and it has reduced the. They are actually telling that it has reduced the ovarian cyst, and the actual molecular mechanism has not studied. Still, it has shown some impact. The next one is Rashid et al. This study is also showing the impact of seed cycling. And in this study, they are actually mentioning the role of antioxidants, omega-3, fatty acids, fiber, zinc, potassium, all the micronutrient part of it. And it had actually reduced the seed cycling, even though it is provided in the correct amount, the seed cycling raises the. Sorry.
By mistake, somebody unmuted. It's okay. You
Okay.
can.
So additionally, the seed cycling raised the blood levels of prolactin and TSH, and which are related to the weight gain in the patients. And the another study is about sesame seeds. They have provided 50 grams of sesame seed powder, and which reduce the plasma total cholesterol levels. So these are some of the nutrients components which are actually helpful in seed cycling, and what is the action they are doing with the mechanism is mentioned here. First one is a sprouted finger millet. The study was done by Moran J, LJ et al. And the iron and calcium in the these are the nutrients which presented were involved in oocyte maturation and helps to reduce the insulin signaling pathway. Then sprouted pearl millet powder, which is a source of vitamin A, selenium, magnesium, MUFA, which controls the insulin. The another study is the flax seeds, which containing omega-3, zinc, potassium, selenium, phosphorus, which increases oocyte production, and selenium also helps to reduce the dyslipidemia and insulin resistance. Pumpkin seed containing zinc, potassium, other minerals like magnesium, which reduce the insulin resistance and decreases the testosterone levels. Sunflower seed, which contains zinc, potassium, MUFA, PUFA, which decreases the testosterone level. And again, sesame seed done by Wu et al. 2006, which is present in essential fatty acids, iron and calcium, which helps to improve the insulin sensitivity in the patient. So in all these studies, what they have mentioned is it has an impact on the insulin resistance. That is a major thing that we noticed in all the studies, and some of the studies had also mentioned about the reduction in the testosterone levels. But all the studies were vague, and they actually not mentioned about the exact molecular mechanism which decrease the testosterone levels in the patients. So the next one is the role of antioxidants. We know that we are actually facing a lot of issues because of the oxidative stress, and the cellular health is the area where we have to focus more on the wellness aspect of it. So we know that the food items which are high in antioxidants, which are rich in polyphenols, which will help to decrease the inflammation, thereby suppressing the cytokines and inhibiting the inflammatory pathways. So some of the examples are cinnamon tea, ginger, chamomile, or spearmint, chatseberry, green tea. So all these are having some components. Example, chamomile is having apigenin and bisabolol, which is an anti-inflammatory component which helps to reduce the stress and support sleep. Then chasteberry is containing flavonoids and deterpines, which are actually balances the prolactin levels and which support menstrual regularity. Spearmint is having rosmaric acid and flavonoids, which helps to balance the androgens and reduce acne and hirsutism. So above all, we know that the antioxidant, there is no measure to detect antioxidants in the body. So it is very important to identify the level of antioxidants in the body using some mechanisms so that it will help you to reduce your inflammation in the body. So when you take the case of PCOS, the inflammation is more in PCOS patients. So the exact role of magnesium is actually it eases the muscle cramps and improving the mood swings, and also it helps to melatonin production and thereby improving the sleep quality, and it also helps to improve the fasting glucose and improving the insulin sensitivity. So these are some foods which are rich in magnesium, and 100 gram of each food like sunflower seeds, quinoa, amaranth leaves, etc. are some of the foods which are rich in magnesium. Even dark chocolate is having high amount of magnesium. And next is the stress management. We know that I have already mentioned that in PCOS there is a HPA axis where there will be more cortisols produced because of the increased production of cortisol along with androgen through the HPA axis. So most of these patients may suffer from stress. So in order to compensate this stress or to manage this stress, the person has to undergo a lot of techniques like relaxation techniques, music therapy, involved in regular routine activities, meditation, some therapies, motivation, travel, exercise, etc. So these are some examples of some relaxation techniques where when I did my PhD, I have included one of these relaxation technique uh, in our study population, that was progressive relaxation. The progressive relaxation technique is actually which helping your muscles from the feet to head. Each each area of the muscle is actually you are going to target on each muscle group, and you are giving a chance to uh, give it more relaxed and to make it more tense, so that within 5 to 10 seconds you will be able to manage each muscle group in your area in your body, starting from toe to feet to head. So these are some examples, and other than that, we can encourage on meditation. Then exercise, deep breathing techniques can be encouraged in the patient. So in progressive muscle relaxation techniques, actually, it is a very simple technique where we ask the person to sit in the chair and to start practicing the exercise starting from the face. Even actually we will ask the patient to close the eyes, tighten the eyes, and then slowly release the eyes. It is actually we actually give them this time of 10 seconds to relax and to stretch it, so that each muscle group is involved in the technique. And the third one is for arms, fourth one is for the shoulders, and likewise the it is fifth one is for the legs, and sixth one is for the lungs. Like that, there are different exercise, more than 10 or 12 exercises are there. So if we practice, if we ask the person to practice it daily at least for 10 to 15 minutes, it will help them to give more relief from the stress. So this I have actually used all these techniques in my research study also. And next one is sleep and hydration. Lack of sleep, actually, we know that it raises the cortisol levels and worsening the insulin resistance. So actually, it also disrupt the hunger hormones too, thereby increasing the food craving for, especially for sugary and high carb foods. And also, it increases the risk of anxiety, depression, and mood swings. And when you give the person adequate sleep of at least 8 hours, it reduces the melatonin, and if it is helping to improve the melatonin levels and to further regulate the reproductive hormones. So what are the physical activities which actually we have to focus in this patient? Exercises like flexibility, aerobics, and strength training are the three areas where we actually focus on. And the strength trainings where the patient can be asked to do the weight liftings and resistance band exercises, like those exercise using the resistance bands, and the low intensity cardio including walking, swimming, cycling, which can help to improve the heart health, and yoga, which help to reduce the stress and balance the hormones and improve the flexibility. So actually in my study, actually I have used a Godin leisure time scale to assess the physical activity level, so as to make it like the time of activities and the type of activities also involved in the study, so as to get a proper quantitative measure of it. So the key messages in this presentation is PCOS is primarily driven by insulin resistance, which is leading to hyperinsulinemia, hyperandrogenism, and chronic anovulation. There are two axes. First one is the HPO, hypothalamus ovarian axis dysregulation, where there is increased LH and altered FSH, which contribute to impaired follicular development and ovulatory dysfunction. whereas the HPA axis is where there is stress hormones will be more produced, and which increases the cortisol, thereby worsening insulin resistance and thereby increasing the androgen levels. Then hyperandrogenism manifests as irregular cycles, acne, hirsutism, and ovarian dysfunction. Weight reduction is the cornerstone of lifestyle management. Even 5 to 10% weight loss improves insulin sensitivity, ovulation, and androgen levels. And we have to choose a low glycemic index, high fiber meals to stabilize insulin and to balance hormones. And always include some micronutrients like magnesium, omega-3, zinc, B complex vitamins, vitamin D, rich foods for better metabolic health, insulin sensitivity, and mood. You can practice seed cycling like flax, pumpkin, sesame, sunflower seeds to balance estrogen and progesterone naturally. But the exact molecular mechanism is still not understood. But we know that there are some effect of estrogen regulation and progesterone improvement after practicing seed cycling. Limit the processed foods, sugars, and excess caffeine and endocrine disruptors, and exercise regularly by combining strength training, yoga, moderate cardio to enhance the insulin sensitivity and to reduce stress. Prioritize sleep at least to 8 hours for stress control and to stimulate the cortisol levels, estrogen, and insulin levels. So thank you very much for the kind listening. Any questions or any doubts if anybody has? I'm
Thank
happy
you
to
so much,
answer that.
Jyothi. You very well explained from the basic key points till the minute details of seed cycling also. I think, Jyothi, you can stop the screen sharing now. There are a few questions. We'll read it out. Okay, the first question is there any guidelines for anti-inflammatory diet?
There is no guideline for anti-inflammatory diet, but as far as we know, like this PCOS is a condition where there is high inflammation is there. So definitely we have to give more antioxidant rich foods. So I can't say like you have to give 4,000 milligrams of antioxidants, and so we have to check. There are mechanisms available. There is anybody has any idea about a machine is there to check the antioxidant level in the body. I have seen that machine. In that machine, when you put the fingers, no, you can see the exact amount of. There are some buttons in that. So the red button is showing if you are having a low carotenoid levels, it will blink the red button. Based on it, maybe. Hello.
Yeah, go ahead, Jyothi.
Yeah, so that I don't know the exact name of that machine, but if the levels of antioxidant is less than 100, definitely it will be in the red zone. So if your antioxidant is more than 400, it will be in the blue zone. So it actually measures the carotenoids in the body. So there are some mechanisms and the researches are being done to develop that kind of techniques, but still the guideline is not available. But we can check the antioxidant level and can supplement it accordingly based on the levels of antioxidant in the body.
Yeah, maybe in simple languages, we can tell our patients that to have like minimum this many portions of vegetables, fruits, and whole grains to ensure that, I think, no?
Yeah.
Okay. Now, next question is, what is caviar? Is it available in India? I think in one of your slides it was shown, no?
What is that?
Caviar, Caviar. Is it fish?
Caviar. That is the egg, the fish roe.
Meen mutta, right?
Yeah, meen mutta. It is not available in India, but it is the richest source of vitamin D. I think it is available abroad. It is available as packed caviar is there, but in India, I don't know it is available or not.
I think in some health stores it is available, but
Yeah,
not
yeah.
commonly available.
Yeah.
Okay, the next question is there any fixed or proven quantity of seeds that is required for hormonal benefits in PCOS?
Yeah, exactly. So as I mentioned, a minimum of 15 grams of each seed has to be supplemented to get the exact amount of lignan and the zinc and magnesium and everything. So minimum of 15 gram of each seed is required.
Okay, next is a bigger question. Good evening, ma'am. I am Pallavi Nayak, recently completed my MSc. I have an androgen dominant PCOS with painful jawline acne and significant hair fall. My thyroid and basic hormonal panels are normal, and my fasting insulin is currently within normal range. However, I have a small fibroid that causes very heavy bleeding on the second day of my cycle, along with prolonged spotting. In this context, how effective is seed cycling for managing androgen related symptoms, especially if insulin resistance is suspected but not overt? Also, given the heavy bleeding, would you recommend checking the serum ferritin levels as part of the evaluation for hair fall and fatigue? What ferritin range is considered? I think you must have a consultation with Jyothi. That is better. So many questions.
But I'll answer in a quick way.
Yeah.
I think for her, for the androgen symptoms like acne and all, if you give more seed cycling, I don't think you will get a proper result for that, because the seed cycling is usually involved in estrogen and progesterone modulation. It is not related to the exact cause of androgen. Androgen reduction will not happen even though if you do seed cycling. Then you have to take some medications like spironolactone, or for acne you have to take some topical applications like vitamin E or some. And I don't think it is best option to start seed cycling in this case. But if you have obesity or insulin resistance, definitely you can do it. And the second question was ferritin. Definitely, if you have bleeding, you have to check the iron and ferritin levels. Definitely, you have to check it, and you have to consult your physician, gynecologist.
Right. Thank you, Jyoti.
Thank you.
So next one mentioned high protein and low carb diet. Could you mention the exact amount of both the nutrients?
Yeah, high protein means actually we have to give at least 20% of the total calories with proteins. And carbohydrate, definitely, as in diabetes cases, we restrict it up to 45 to 50. So likewise, you can do, depends on the, it is individualized diet only. But usually we can say it is up to 45 to 50% of complex carbohydrates. And proteins, mostly of all the essential amino acid containing protein is must, because there will be hyperglycemia also some in some patients.
All right, thank you. Next one, do genetic variants in fats genes affect omega-3 metabolism in women with PCOS?
Maybe I don't exactly, I don't know, because I have not seen any studies related to this. But there are maybe there may be genetical variations will affect the omega-3.
Okay, next is a compliment. What a wonderful presentation, dear Jyoti. Congratulations from Krishna RCC. Okay,
Thank
next
you.
one. Next one. Good evening, ma'am. Can lean women with PCOS still have significant insulin resistance, and should their nutrition therapy differ from obese PCOS patients?
Yeah, that is a good question actually. We have seen a lot of lean PCOS cases. They have hyperinsulinemia, even though they are not having obesity. There are some cases you maybe heard about the in diabetes remission recently. It is a everybody is practicing, even in the lean individuals. Diabetic remission is possible with a low calorie, low carbohydrate, low fat, high protein diet. So the same diet we can follow even in lean PCOS, which will help you to reduce your insulin levels. You can follow.
Okay, but is it challenging? This is my doubt actually. Is it challenging for getting better results in lean PCOS patients compared to the obese ones?
Yeah, I have seen some of the lean PCOS cases, even with the 5% weight reduction, they had achieved a better glycemic control and proper menstrual regularity.
Maybe we
And even
have
they
to
got
focus.
conceived also.
Okay, we have to focus more on fat loss and building more muscles in
Yeah,
such
yeah,
way.
exactly. But you have to focus on the proteins.
Okay, fine. Okay, then next one, spectrophotometer is commonly used to measure antioxidant activity. You were saying the name, you don't know.
Same.
So Sripriya has
But
mentioned.
spectrophotometer, I don't think that the machine which I have seen is exactly that, or no, I don't know. I have seen it recently. But the name I don't remember. Anyway, I'll check it and let you know what exactly that machine's name is.
Right. So next one, useful and informative session. Thanks, ma'am, from Manisha. And thank you so much. Your session was truly helpful. Next question, please explain artificial sweetness, how to affect in PCOS people.
No,
Artificial sweetness.
No, artificial sweeteners actually, if the person is not using sugars, mean they can use it, but definitely it will your area, it will definitely affect the gut microbiota. So over usage is not advisable, definitely, because gut is also involved. Dysbiosis is always there in PCOS. So if you give more the artificial sweetness, it will affect the gut microflora. So I don't think
Maybe
it's
for
the
weight
best
reduction,
option.
maybe using artificial
Yeah,
sweetness might be a good option, like
not for a
calorie wise.
long-term use.
Okay, right. Okay, protein shakes are useful in PCOS or not?
It depends on the which item that you are using for the protein shake. Uh, Definitely, if it is protein rich, it will be helpful with high fiber and low carbohydrate. Definitely, it will be helpful. But focus on the antioxidants and the micronutrient part.
Okay, right. So we are done with all the questions. Okay. So thank you so much. Any other quick questions? We have maybe 2-3 minutes more. Anybody want to share anything? Please feel free to unmute and you can share your comments. And so many people have given applauds and congratulating messages. Thank you so much. And I think even the relaxation technique you mentioned, no, like it's very easy within 2-3 minutes. We could have actually included a practical in this. I feel now, no, just like everybody would have enjoyed it. Okay,
Hi,
so I think
can you hear me?
yeah, Sripriya, carry on.
Jyothi, since you have done your PhD in PCOS, I have this question.
Yeah.
What is your view on this genetic variations in fat genes affecting the omega-3 metabolism in women?
Oh, that is
That
what
question.
you have asked that question.
Yeah.
I don't know about it because I have not done any genetic study based on this. But definitely, I already mentioned that there is a genetic role of uh,
Mm,
epigenetics and genetical involvement is there. But
mm.
I have not read any articles related to this too.
Okay.
My study was about the supplementation of
Mm,
one nutritional supplement in and showing its impact on the glycemic parameters and the hormonal levels. That was my
oh,
study.
okay.
So
So, but,
maybe, yeah.
how far you used seed cycling in your study? What was because seed cycling is still not having any RCTs. So how
No,
far do you feel it is come like with your
no, I
patients?
have not done seed cycling. I have included all items which are actually rich in this micronutrient content and prepared. It is not a seed cycling method that I used. I have
Mm,
included all the components, including the millets, bajra, and all the ragi, all the sprouted and dried millet
mm,
powders, and along with the seeds
mm,
so
mm,
that it actually helped the patients to improve their reproductive health as well as most of them almost I have done
mm,
for 90 subjects and more
mm,
than 10 subjects got pregnant also, they conceived also.
mm.
So I have not done a fertility study in this aspect. My
Okay,
concern was only the testosterone levels, but I have noticed a significant reduction in the testosterone level of this free testosterone,
okay.
but no
So
impact on the acne or any other clinical parameters.
okay. So, but
Duration.
whatever it is, like seed cycling is very famous nowadays because of
Hmm.
thanks to
Hmm.
internet.
Hmm.
So, like, what is your view on that? Like, apart from your study, have you done it for any of your clients or patients?
I'm not doing a seed cycling method, but I do encourage seed cycling because it has some impact definitely. But
Because of the nutritional benefits you are
yeah,
advocating, right?
nutritional benefits are there, but we can't exactly tell the mechanism, like why the testosterone level has come down. We don't know about it. We are actually believing that this lignan in the flaxseed is actually helping to boost the estrogen levels and to regulate the estrogen. It is not causing too much estrogen, and it is not causing too low estrogen. It is actually modulating the estrogen.
Balancing.
And zinc and vitamin E is also helping as antioxidant. So these are the two things which actually works in the FSH, follicular phase of it. In the luteinizing phase, where these seeds will help them to increase the progesterone levels. So actually, we actually give more progesterone during the luteinizing phase to reduce the bleeding or any other complications of related to the PCOS. So if we give more of this sesame seeds and sunflower seeds and all, it will help the increase the progesterone levels.
Okay.
I think in our group, no, when the discussion had happened about the seed cycling, many of the freelancing dietitians are using it because in the hospital setup, we may not be able to follow the patient.
But
like
nobody has done the progesterone level. If
Yeah.
somebody had done the progesterone level and to show the mechanism, then it would be like it would be proven actually. It's
Yeah.
only showing we are actually looking into the superficial factors like menstrual cycle regularity, weight loss, insulin resistance, fasting insulin levels, everything we are checking, and lipid profile, everything we will get as like beautiful, significant results we will get. But the mechanism is progesterone increase and estrogen reduction. That is, we are not actually checking. That is what I think.
Yeah, there's for more research on that topic. I think, no?
Yeah.
So many other questions are also coming because of shortage of time. I know Jyothi is joining us from the hospital after her long working hours. So I don't want to make you wait for more time. So thank you so much. The questions maybe in the future or the group we can answer later. So thank you so much, dear Jyothi, for patiently and very in detail you were taking us through the PCOS and your research based, evidence-based details you were sharing. Thank you so much. And thank you each one of you for joining us today and hope to see you all again for another wonderful session. Thank you so much.
Thank you very much. But at this outset, I would like to thank the CNF team for inviting me for this program. And I also invite all of you to the program by Dr. Krishna Sriram, Advances in Enteral Nutrition, which is jointly conducted by Believers Hospital and CNF. So welcome all of you to the program. If anybody has any doubts regarding the program, please contact us.
Sure.
It is on 19th of this Thursday. So welcome all of you to the program.
Share the details in our Insta and social media as well as in the group, Jyothi. Thank you so much.
Thank you.
Thank you. Thank you all. Good night.
Thank you. Bye.
Yeah. Bye.